Hi, welcome to our broadcast. My name is Dr. James Simmons. I am a board certified nurse practitioner and founder of Ask the NP, and I want to welcome all of you to be here. Of course, as a reminder, the information provided during this event is for informational purposes only. For any medical questions, please reach out to your primary care provider or other health professional. I also want to give a little bit of a disclaimer here that we're going to be talking about some pretty sensitive and pretty personal topics that may be upsetting for some folks. So please know that will happen, but these are going to be real and fantastic conversations, and we hope helpful. If at any time you need help with anything, there are always Providence resources at providence.org, of course, as well as 1-800-273-TALK is the National Suicide Lifeline. If you need help or you need help helping someone, those resources are always available to you. So joining me for this conversation is Dr. Arpan Wagre, Chief Medical Officer, Behavioral Medicine at Providence, and Josh Cutler, Senior Clinical Manager and Psychotherapist at Providence and Swedish. Hello, gentlemen. Good afternoon.
Hi, James.
Hey, James.
Hello, hello. So first off, for the folks who don't know you or don't know what you do, just let everyone watching what your roles are. Josh, let's start with you.
Yeah, so I'm a licensed clinical social worker based in Seattle, and I'm trained as a psychotherapist, and in the last couple of years have been really focusing my work on taking care of our healthcare providers who are working on the front lines. So have had a lot of doctors and nurses and administrative staff who've been seeing me over telehealth for counseling. And then I also have been running a team that we built that does that work as well. So that's the management part of my title and role. And so started my work in our health system at Swedish and have continued that work at Providence, and have worked really closely with Dr. Wagre and have been really lucky to have been able to bring some of his vision to life.
Excellent. Thank you, Josh. Dr. Wagre?
Well, thank you so much, James. And this is really exciting for me to be able to partner with my friend over here, Josh Cutler, whom I've known for many years, and have a real conversation. So I serve as Chief Medical Officer for Behavioral Medicine at Providence. I'm a geriatric psychiatrist by training. And part of the role at the system is to try to do three big things. I mean, we want to make sure that we have the best place we have access to mental health resources and support for all our caregivers, 120,000 caregivers and their dependents. Second, our day job, taking care of our patients. So if people do trust us with their care, that we always show up for them and meet their needs as a whole person, mind, body, spirit, with no wrong door. And we also have a responsibility towards our communities and making sure that we're focusing on improving the mental health and well-being of our communities. And the area of focus for us is through the Work to Be Well program that Dr. Henderson leads, and promoting youth mental health and resilience. So that is the body of work across our 7 states with a multidisciplinary team of awesome people that I'm privileged to be a part of.
Neither of you are very busy or very involved. Yeah, neither of you have much going on at all. It's very clear. Dr. Wagre, you mentioned trust, and I think that's a hugely key component of having difficult conversations about mental health in general, but in particular about suicide. And that may be a key, but if you could share with us some of the other keys about how you might start or initiate a conversation with someone who you think might be experiencing suicidal thoughts.
Well, thanks, James. That's a beautiful question. And before I get into trying to answer that and give you some examples, I had maybe 2 comments that I wanted to share. First, just the importance of starting a conversation. So when people are in that emotional anguish and that extreme distress, externally, you might not be able to pick up on that. And I think being able to start a conversation and have a real conversation can save a life. I think I want to underscore the importance of this. I know it's difficult, but it can save a life. And the second thing I want to, there's this myth that asking about suicidality might actually plant a suicidal thought in somebody's mind. And I want to dispel that myth before we even get into the conversation. That is not true. That has been researched, and asking the question actually might save a life, not plant the suicide, might not plant suicidal thoughts. So having said that, I think this is really tough, right? What you need to do is to be able to create a safe space. I would say, genuinely being present and listening to people with empathy is probably one of the most important things that we can do to start a conversation. What I have found helpful is in some way or form to normalize the conversations. If you would like to share about yourself, sometimes that creates mutuality and makes it easier for people to talk about some very difficult topics. I have always tried to use things like, using I statements. I've noticed that you seem this way, and I want to be able to help you. And that really helps. It avoids people becoming defensive, and you also want to be very, very careful that you're validating people's emotions. You're asking open-ended questions. Direct questions are important. You seem this way. I'm very concerned that you might. I'm very concerned about you. Are you having thoughts about harming yourself? And that allows for a safe space to start a conversation. The last thing I'll say is that you don't want to get into a place where you're analyzing and trying to fix the problems. When you're starting the conversation, you want to create a safe space. So those are some things that have worked when I've tried to start these conversations, and I hope that helps our listeners.
Absolutely. I was just taking notes while you were doing this, just to sort of recap. Creating a safe space, starting with I statements, being direct. I think this is one of the most important, aspects about this, at least in my experience, is that this is not a place for us to use our corporate speak, yes. Right? This is not a place for us to sort of PR our way around the issue. You have to be direct, even if you think it's going to make the person angry, and even if the person that you're talking to does get angry. That's okay. It's better to have an angry friend than one friend that's not around, right? Or loved one. So thank you so much for sharing that. Josh, you recently published a memoir, sort of on your personal reflections as a psychotherapist, but also, Josh, you have a really sort of compelling personal story that I really think everyone listening to would benefit from, and I sort of just want to create a safe space here. And using I statements, I will directly ask you if you would like to share, some of your personal journey that I think could be really, really helpful for the folks watching.
Yeah. So my book is called The Day Hospital, and the first edition actually I wrote before COVID, and I published it anonymously. I wasn't ready to put my name on it, and I blacked some parts out of it. But I got to the point where I shared it with some people and got some good feedback, and just decided that I wanted to write a second edition with my name on it. And I added some additional experiences of what it was like to work as a therapist during COVID with healthcare providers. But the premise of the book, where it starts, is at the day hospital, where I actually had a little bit of a breakdown myself a couple of years ago, and ended up going into a psychiatric day hospital program. And it really helped me a lot. And I was really struggling with depression, which is something I've actually struggled with for most of my adult life. It wasn't a new thing, but it was something that I felt like I was managing pretty well until I wasn't. And so I was able to luckily be surrounded by a good group of professionals and really supportive colleagues and family, and also was able to then get into this program where I got some help. And then so the book is about my experience both in that program, and then reflecting on my life kind of leading up to that, and then after that, both weaving together stories of working as a professional and also as a patient. So it's been a really interesting journey that's really been kind of two parallel paths as far as what people have experienced. And I'm trying to be at a place right now where I'm integrating some of this, some of these life experiences a little bit more in my story, and being a little bit more open, because the reality is it's all of who I am. And some people that know me actually pretty well have read this book, and they were like, wow, I had no idea that this is some of the stuff that you'd been through. And so it's been definitely kind of a healing journey for me to be a little more vulnerable. I wouldn't just suggest anybody come out of mental health treatment. You don't have to suddenly tell everybody about it. It's been a long-term process for me, and there's certainly not, certainly held some things back, but I'm really glad to be able to share this, and I really appreciate how supportive Dr. Wagre has been of this journey. He wrote a nice praise for it in the front of the book, and he actually appears a couple times in the book as being a supportive mentor during that process. So,
thank you, Josh, for sharing that. I know that it seems so easy for you to share that right now. By the way, us being on the outside looking at you, but I know that was probably very difficult, and has taken a lot to get up to that, to share that publicly. So thank you. You mentioned people who knew you really well didn't even realize some things were going on, and I think that's really, really common, including Dr. Wagre, who, if I understand, was your boss essentially, right? And how did that dynamic work? And how could that be helpful for those watching when you might need help, and the help you might need may impact your ability to continue doing your job? But it's also really important for you to have that conversation with a superior. And can you talk about that situation a little bit?
Yeah, and I would say, yeah, Dr. Wagre is amazing, and I've loved working with him. And in this instance, I had applied to HR to get some time off because I needed that to go to this program, and I was kind of thinking, should I mention this to anybody? I didn't have to, and that's also something that's totally. You're right. I want to make that clear. If you don't feel comfortable talking with your boss about this stuff, you don't have to. But he just had gotten notice that I was taking some time off and was asking how I was doing. And I just decided, you know what? I trust this guy. And I'm going to tell him what's really going on. And that is the first time I'd ever had that candid of a conversation with a supervisor about my mental health. And my supervisor happened to be a psychiatrist at that moment, which was kind of an interesting twist.
Sure.
And so, he was overwhelmingly supportive. I was a little bit terrified because I'd been definitely a rising star in his group, and we were in the middle of a huge project that I didn't want to drop the ball on, but it was like, I've got to take some time off and take care of myself. And he made that clear that was the first priority for me and my family. So I'm forever grateful for that.
Josh, you're just so kind. James, you picked up on that. You picked up on it so well. How hard it must be for someone like Josh to share a story, and yet he's doing it with so much ease at this time. That takes a lot of courage. And for our listeners who don't know the work that Josh was doing, he was single-handedly building a program for all Providence caregivers to help them at some of their darkest hours. A behavioral health concierge service that really met the needs of any of our caregivers or their dependents. And, it was one of the most successful programs that we've launched. And the stories were just so powerful, how people were able to get help. As a provider who's helping and supporting people during some of their darkest hours, hearing all the pain and the trauma that people are going through, you can just imagine how hard that is. You're a container, you're holding everything, but we're human too. And so I think being able to take care of yourself and be able to say that I'm going to model self-care. I'm going to take care of myself first was a very important step. And I'm also so happy that Josh is at a place where he's able to share this with people. I can't emphasize the importance of that. There are so many people who are listening right now who are struggling, and the stigma just prevents you from having a real conversation. And you don't need to be struggling. You don't need to be hiding this. Just please be able to get help for yourself.
And that stigma is so incredibly powerful, right? It not only from we think about sort of stigma in a larger sense, right? Like at this, Gestalt level of society has this stigma, but it really often comes down to a personal stigma that we have ourselves, and judging ourselves. And Josh, I kind of want to I want to highlight a little bit and see maybe if you can share with us just a little bit about the juxtaposition between what was probably happening in your mind between developing this program for caregivers who need mental health support and finally realizing you needed mental health support yourself. How, I think this is probably something that's unique to you, but that lots of other people realize. I have to keep working to pay the bills, and I got to take the kids to soccer practice, and we have to be safe from COVID, and we have to do all these things, and I have to blah, 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 and fix the house and all these other things. And also, like, if I do one more thing, that's it, I'm done. I'm going to crack. And that's while your situation is unique, I think it's relatable to a lot of folks, if you wouldn't mind expanding on that a little bit.
Yeah, and I would say I'm pretty good at compartmentalizing. Maybe too good. I think us healthcare providers, we're pretty good at, walking into the clinic, or if we're doing virtual, turning on the virtual screen and just somehow all that stuff that's going on for us, we just managed to shove to the background, and we show up with this professional persona. And I've been doing that for a long time, and I can do it pretty well. But there comes to a point where that's no longer sustainable. And I'm really passionate right now, and I know Dr. Wagre is as well, about creating more upstream solutions so people don't get to the point of a total breakdown. And the pressures right now that everyone is experiencing on top of just regular life pressures. I mean, I've been working in mental health for a long time. We've always been pretty busy and people, humans have challenges, but the added pressure of this shared trauma and experience of COVID has just put so many people over the top. And some of our past coping skills and mechanisms and routines have just gone out the window. And so making sure that we're, upstream, making sure to stay connected with friends, stay connected to our health and our bodies and sleep, and potentially reaching out for, mental health help, which can start with a conversation with your primary care doctor. We have across the Providence system a lot of behavioral health supports just right within primary care. You don't necessarily need to call a therapist. We know that that's a hard system, the specialty mental health system, to access. But starting that conversation, even if you're there for something else, you're there for a COVID test, mentioning to your doctor, hey, I'm having some of these other concerns, and they're well trained to be able to support you with that. And that's something that Providence continues to work on. So yeah, just checking in with yourself when you're feeling like, yeah, on the outside, I'm smiling and I'm going. And I mean, I had that weekend. My daughter had 2 soccer games back to back. Like, I was like, this was a weekend. And then we had all this other stuff to do and cleaning the house. And, I've got 2 kids, and it was just like, and I found myself, this is a funny personal anecdote, but I couldn't sleep one night. And we have a minivan that's just totally trashed, family minivan. The floor is just covered with family detritus. If you've got kids, but I found these videos of this guy like detailing minivans, and I swear to God, I like watched this in the middle of the night for a while. It was like really relaxing, and it was just like cathartic of wow, you can get a family minivan clean, and so whatever it is, find something that can help you relax. And I'm not quite ready to take on my own van, but living through vicariously helps.
Absolutely. I think you mentioned upstream quite a bit. And I think for the, providers watching, and really everyone watching, but, there's been some fantastic work with the, caregiver mental health network and kind of what's going on with that. And I know some folks I would like to say common knowledge within the organization, but I think there are a lot of individuals who maybe not fully understand the breadth of the program and what it's able to offer and how many people are accessing it and what's that available. Dr. Wagre, I don't know if you can expand on that a little bit for those watching.
Sure. Maybe I'll start with, how we approached mental health and well-being services for our own. It was March of 2020 when it was about 1.5 months after we had admitted the first COVID positive patient to our ministry up in Everett, and really trying to think, like, how do we create a system where if any of our caregivers want access to mental health services, that there's seamless access available based on their needs and preference. I mean, I think you call that out, the upstream. Like, it doesn't mean that everybody needs to speak with a therapist, but if I want self-help resources, how do I find them? So literally over a weekend with our digital innovation group, Josh and myself, we created a stress meter that's been used 30,000 times And it's been one of the more powerful resources. So, for example, if people want self-help resources, we have a partnership with folks from UC Berkeley. They click on, this Credible Mind thing, and you can go and say, well, rather than being overwhelmed or underwhelmed by a simple Google search, you kind of say, I want help with, say, parenting during the pandemic. And my preferred medium of learning is, say, a podcast. You put those filters in, just like a Yelp-like 5-star rating based on what providers say, you get good curated content. And so that was one thing. To tele-spiritual health, we found, was something that people really, were finding helpful or clicking on. We found that the most commonly viewed topic at that point in time was compassion fatigue. And I can see how that might be coming back again with the Delta surge and all those who are caring for people who are not getting vaccinated and everything else that goes with it. And so we have that. And then the concierge, right? All this itself can be overwhelming. I want a phone a friend option. And that's where it comes in, Mr. Cutler, with all his amazing services. And we had 10,000 visits to this. So it just gives you a sense of how much. And then on the other side, we recognize that help-seeking behavior doesn't come naturally to people in healthcare. So while this was helpful for the small subset of people who raised their hands and got help, then we had to make sure that we're putting in place a proactive approach. So this is where we partnered with the American Foundation for Suicide Prevention, and we launched a program called My Mental Health Matters, in which you have an annual mental health checkup. And I think, it's very early. It's been about 6 weeks or so since we've been doing this. And we found some really concerning statistics. We've found some really concerning numbers there. So about 1,450 of our caregivers took this assessment, and 61% of them were in tier 1, that is extreme emotional distress and at risk for suicide. And there were 98 caregivers who were describing active suicidal thoughts. So and every one of them was responded to with a personal message from a therapist, and so hopefully intercepted and provided and sent on a different path so they get help. But that's the level of stress and suffering that those in healthcare are dealing with. So yeah.
Wow. And I mean, that's fantastic work. The statistics you just gave, though, the numbers you gave are as a healthcare provider, I guess I have to say not that shocking once I sort of step back, but being able to have a tool like this that identified 98 individuals who were actively having suicidal thoughts, I think this helps us to sort of open up this conversation a little bit about, what are some misconceptions for those 98 individuals and other individuals who are experiencing suicidal thoughts in that moment. I mean, I think people who have never had suicide happen in their family or with loved ones or whatever may not understand sometimes the thinking and the mentality that's going on with someone who is actively suicidal, caregiver or not.
Yeah, you raised such a good point, and I was reminded of a story shared by David Cummington, one of the zero suicide experts, and he describes this instance where. So I want you to stay with me for a second and try to visualize this, right, when you're thinking about people who are suicidal, because we talk about suicide as a choice. We used to, for many years up until recently, and some still do, say this person died by a heart attack, but that person committed suicide, right? Now the field has moved away from using the words like committed, but I just want you to think about this for a second. Say you're hanging from a cliff, right? You're hanging from a cliff, and below you have all these rocks that if you let go, you're going to die, right? You're hanging on, and you're hanging on with dear life. You don't want to let go. You don't want to let go, but after a while, gravity, fatigue, just the pain starts getting the better of you. You're hurting, and you're in such distress that death is there, and you let go. And that's what people have described as that emotional anguish and pain before you go to that step of ending your life by suicide. And I don't think many people can relate and understand how serious this can be. And so I wanted to call that out. And I think that story to me is one that really, paints a picture, because people can relate with physical pain. They can see that, right? If you have a broken arm, people sympathize with you. They empathize in a different way. But if you're very severely depressed, many people just can't see that. They can't see that anguish and pain. And that makes the suffering even harder for someone who's in that situation.
Absolutely. I think there's so much that we you know, how do I say this? It's not that mental health is new. The way that we are addressing it and the way that we are relating to mental health as a part of our overall, you know, mind, body, spiritual health is so new. And people, you're right, can relate to a broken ankle. It's difficult for them to relate to, you know, emotional pain, mental health pain. But that analogy was great, of someone hanging on and then it just becomes overwhelming, you know, at some point. And we have some of the resources going across the bottom here. I want to say this out loud. It's one of my favorite resources in the world. 1-800-273-TALK or 8255 is this National Suicide Lifeline. As well, the crisis text line, you just text home to 741-741. I'm a texter. A lot of people are texters and they prefer an interaction that way. But specifically, we've talked kind of about mental health in general, but Josh, in particular, individuals who may be at that moment, you've identified as suicidal, there's a plan and many things that need to occur to intervene. Can you discuss sort of what Providence resources are for that and how that works, particularly for caregivers?
Yeah. Well, first of all, if someone has a plan that they're actively planning to carry out, calling 911 or going to the emergency room is really your most important next step. But if it's not quite to that point, and somebody, I mean, having some fleeting thoughts of suicide is actually relatively common. I talk with a lot of patients about it, and they're far from being at a dangerous place. But you want to make sure and get those people help as well before they get to a worse place. The recommended intervention is to make a safety plan, and you can do that with your primary care doctor. If you end up going to the emergency room but you don't go on for further care, they're going to work on setting up a safety plan with you, which is going to include people you can call if you're distressed and you're thinking about hurting yourself. Also, potentially some exercises or strategies you might use to help calm yourself down. And some additional numbers you can call, like some of the ones that we're putting across the bottom of the screen. But if you're concerned about somebody that's in this place, whether it's a friend or it's a patient that you're seeing, keeping in close touch and letting them know how much you care about them and that they're not a burden and that's not a problem, and keeping just a consistent schedule of, hey, we're going to talk tomorrow at this time. Is just really important to know that you're out there and you're thinking about them, and making sure that, again, there's a safety plan to rather than contracting and making them promise to never do anything. That doesn't necessarily work. What we want is to help people to feel that they have a number of resources if they get to that dark place.
You brought up, you know, contracts used to be popular back in the day, and you brought up not doing contracts. Dr. Wagre, are there, you know, in just the brief sort of 90 seconds we have left, other things that folks should not do in a situation like that? You two are both highly, highly trained individuals who this comes second nature, but for even other caregivers or people watching who are saying, okay, there's someone in my life who is suicidal, what is something that they should not do in that scenario when they're trying to help?
That's a good question, James. You know, one thing that comes to mind, I think, like we talked about in the earlier part of the conversation, creating a safe space and asking open-ended questions. I would definitely avoid, missing that opportunity to have a real conversation by saying something like, well, you're not feeling suicidal, are you? Or something like that, where it's closed and you're kind of putting people in that situation where they're not, you know, if they're already struggling and it's hard enough for them to start a conversation, and closed questions like that, or those kinds of comments would just, you know, miss that opportunity. And I think also just kind of thinking about this differently, that suicide prevention is not just the responsibility of behavioral health or the healthcare sector. This is a societal issue, and all of us need to be a part of that. So schools, faith-based communities, you know, we need to make sure that everyone is playing a role in this.
Absolutely. I'm so glad that you brought that up, that it's on all of us, really, yes. Right? Particularly when someone is, you know, actively suicidal, which that's even different language that I know we're potentially sort of trying to get away from, but say something. But I love that you said, because it's uncomfortable for everyone, right? To sometimes say something and then to go say, well, you're not suicidal, are you? There's a lot of judgment. There's a lot of stigma in that, you know, that approach. So thank you so much for sharing that. I did want to just address right before we leave. I'm so sorry. I saw that there is a Facebook question. Has there been an increase in suicides among healthcare workers since the beginning of the pandemic? I know I have a little bit of data on that, but it's actually older. It's from this spring, and the short answer is yes. My data is particularly among nurses, and it's striking. The percentage of nurses who were in that kind of tier 1 that you talked about before, Dr. Wagre, but just in the last few seconds we have. Do you have any information or data about that for our question?
It is interesting. So depression, anxiety, deaths by drug overdose have clearly increased. The data for deaths by suicide is lagging. There was one study across 21 countries that had some data that actually showed that we did not have a significant increase, but it's still early. And so, one would be concerned about it, but we didn't. And a part of what people were using to explain was sometimes in the context of natural disasters and events like this, the community comes together in a very different way. And maybe there's a protective component, but I think it's just a little too early to have all the answers on this because some of this data lags and we see things later down the road.
Absolutely. Thank you for that. And thank you for letting me put you on the spot with 10 seconds to go. I appreciate that. Dr. Wagre, Josh Cutler, thank you so much for doing this and having these conversations. Discussing suicide is difficult, but doesn't have to be. And I'm so glad that Providence is allowing us to do this to try to continue to normalize these conversations among everyone. And I am biased, but particularly for the other healthcare providers out there, that a lot of us are really struggling. So thank you. And Josh, in particular, thank you so much for sharing your story and for being vulnerable. That's real. And I guarantee you that you touched people with that. I know you did me as well, just for sharing your story. So thank you. As you'll see it scrolling across the bottom, those folks still watching, if you're looking for a behavioral health specialist in your area, of course, please go to providence.org. Always, I will say it one more time, 1-800-273-TALK. If you need help or if you need help helping someone, I always think that that's really important. And the crisis text line as well. Text home to 741-741. Thank you both for joining us. And of course, make sure you follow us on social media at Providence Health System on LinkedIn, Facebook, and Instagram, and under Providence on Twitter. And they want me to say something about following me, but it's fine. You don't have to do that. Just follow Providence. All right. Thank you both very much. Thank you, everyone, for tuning in. Hope you have a great rest of your Monday.
Thank you.
Thank you.